Hello, my name is Yasue Fukuda. I am a professor in the Faculty of Pharmaceutical Sciences at Suzuka University of Medical Science in Japan. I recently published a paper entitled Public Attitudes and Predictors of Public Awareness of Personal Digital Health Data Sharing for Research, a cross-sectional study in Japan in JMIR Human Factors, together with my co-author, Professor Koji Fukuda of Waseda University. Around the world, healthcare systems are undergoing a digital transformation. Electronic health records, wearable devices, mobile health applications, and artificial intelligence are generating unprecedented opportunities to improve healthcare, accelerate medical research, and support precision medicine. International initiatives such as the European Health Data Space and the WHO Global Strategy on Digital Health highlight the growing importance of responsible health data sharing across healthcare systems and national borders. However, none of these initiatives can succeed without one essential ingredient: public trust. If people are unwilling to share their health data, even the most advanced digital technologies cannot achieve their full potential. This raises a fundamental question. What makes people willing to share their personal digital health data for research? To address this question, we conducted a nationwide survey in Japan involving 1,000 participants representing different age groups and both sexes. Although our data come from Japan, the issues we examined are shared by countries worldwide that are seeking to build trustworthy digital health ecosystems. Participants were asked about their willingness to share many different types of digital health data, including medical diagnosis, genetic and laboratory information, lifestyle data, mental health information, and social communication data. We also examined 5 groups of factors that may influence data sharing decisions: demographic characteristics, the type of data requested, motivations for sharing, concerns about sharing, and preferences regarding data governance and access. Our findings showed that approximately 70% of respondents were willing to share their digital health data for research. The strongest motivation was the desire to contribute to future patients and medical progress. Receiving personalized health feedback also encouraged participation, whereas financial incentives had a much smaller influence. At the same time, concerns about trust and governance played a crucial role. Participants were much less willing to share their data when they feared unethical use or when the terms and conditions were difficult to understand. Interestingly, willingness also differed substantially depending on the type of data involved. While many participants were comfortable sharing clinical information, they were considerably more hesitant to share social communication data, despite its potential importance for mental health research and public health. Perhaps the most important finding was that transparency and accountability matter as much as privacy protection. People were significantly more willing to share their data when they clearly understood how their data would be used, who would use it, and for what purpose. Trust was also considerably higher when public institutions and universities, rather than commercial organizations, were responsible for managing the data. Although this study was conducted in Japan, its implications are global. As countries continue to develop AI-enabled healthcare, learning health systems, precision medicine, and cross-border health data infrastructures, policymakers face the common challenge of balancing innovation with public trust. Our findings suggest that trustworthy governance depends not only on secure technologies, but also on transparency, meaningful consent, public engagement, and institutional accountability. We hope this research contributes to international discussions on health data governance and supports the development of people-centered digital health ecosystems that enable responsible data sharing while respecting individual rights and public expectations. This is one of the reasons we chose to publish our work in JMIR Human Factors. JMIR provides an outstanding international platform for interdisciplinary research at the intersection of digital health, human behavior, technology, and health policy. We hope our findings will contribute not only to future research but also to evidence-based policymaking and international collaboration toward more trustworthy digital health systems worldwide.